Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
All right. Well, this is another wonderful show, of course. What we really try to do on our radio shows is to help the community understand information, and we do research, and we have very, very smart people who we bring on the show, people who are in the medical field, financial field, other kinds of fields, but especially someone like Lcurtis, who's been in the, I would say it, in the field of helping elders for a long, long time. She is a nurse, which is great, but she's in a bigger position than nursing. There are a lot of people that can do nursing, but not what she can do. And she is out there letting people know, other kinds of the public who needs to understand what growing older means, from whether it's you want to go into a facility, you want to stay at home, you want to talk about hospice. But today we're going to talk about something that's really important, and that's getting inoculated against various diseases. So thanks for coming today.
Thank you.
I know you have a busy schedule too, but you're really great, and people really like what you say. And I think the most important thing today is preventive medicine, and I believe that inoculations is a form of preventive medicine, don't you?
Oh, absolutely. Absolutely. Especially, I shouldn't say children and the elderly, are
the most exposed, aren't they?
and the ones that will really get hit the hardest.
Well, because we don't want people to be sick, then they wind up, especially with the flu. If you don't have an inoculation and you're an older adult, it could really go from mild to worse, and you wind up in a hospital, and then you wind up with other kinds of things, sepsis. So why don't we do everything that we can to help people now at home, or if they're in a place like Regents Park of Boca, take care of them. It's so simple. It doesn't hurt. Do you get your shots?
Oh, absolutely.
So do I.
Yeah, and there are a lot of people that's just mostly younger, 30s, maybe 40s, that say, oh, I've never gotten a flu shot. Well, you catch it one time, and the older you get, the more it hangs on. And I get it every year.
Some people carry around myths, and I have friends, and I'll say about the flu shot, oh, no, I would never get a flu shot.
Right.
It's a myth, and maybe they'll never get sick, but they'll be the first one when they get sick to moan and groan and be in bed for a week and never feel really good for a few weeks. It really takes you down.
Yeah, it's debilitating. It really is.
And now there are different strains of virus, of the flu. So I know that I, of course, go to Dr. Mencia, and I get my shots, and he tries to have the latest and enough of it so he doesn't run out. Remember that time that everyone ran out?
Everyone ran out. You couldn't get it.
But for the older adults there at Regents Park, how critical is it for people to have their inoculations?
We every year, when flu season comes, which starts October 1st, we really try to get them, whether they're long-term or short-term, we offer it to everybody. Obviously, they have the right to refuse, but we encourage them to get it because it is contagious. Look at people going on cruises. They all come off with, when flu season hits, it hits. And so we encourage all of them to get the flu shot. Like I said, some of the people coming in for short-term rehab may have gotten it already. But if they haven't, we strongly encourage them to get it, as well as the staff. You don't want staff walking around with the flu either. So we provide that for our staff as well.
And if you and other people like I am, of course, I get the pneumonia shot, and I'm going to be getting, other shots that are going to help me. As long as the scientists are developing these shots, why not get them? So I want to ask you, though, when we get a shot, I don't write it down somewhere that I got a shot, and maybe 6 months from now, I don't remember.
Right. Especially ones that you don't get every year, like the pneumonia shot. I know I've gotten it. I don't remember when. You're absolutely right.
So I go back to Dr. Mencia's files, to his office, and I'll say, when did I get the pneumonia shot. I do not remember, and you don't get that every year.
Right. So it's important. You're right. You should go to your physician. The problem is with different insurances, if it's not just Medicare, they've changed primary doctors when their employer has changed insurance companies. So maybe they have, let's just say for instance, they had Humana, and they go to another job, and that job has Blue Cross Blue Shield. Well, you have to change doctors to find a primary that's on your plan.
Okay, and that doctor wouldn't know. They don't keep a record.
No.
That's very interesting. I never knew that. So if you're in one plan and you go to another, the record does not follow you.
No.
I that's surprising.
So,
I never heard that before.
Yeah. I mean, you can ask for a record, but, a lot of people don't. And, the new primary takes a history and physical. But, yeah, you would never, they don't all ask for the record. So,
well, that's what this show's all about today. If you're going to move from one office to another, ask for your records.
Right. Absolutely.
And if they look at you and they make some excuse, you have a right to get your records.
That's right. Yeah, so, that's an important piece of this whole puzzle.
So when people come to short-term rehab at Regents Park of Boca, do they bring records, or how do you get their records?
All we have is what the hospital sends us.
You don't have what their doctor says?
No, and usually the doctor in the hospital is not their primary doctor.
So what do?
You have to ask them and hope they remember when they got their different shots. Usually, I shouldn't say, most of the time, the short-term rehab patients, they kind of know if they got the flu shot yet, because that's an annual thing. The pneumonia shot, they may not remember. Just like
we don't.
Yeah.
But they don't call their doctor and get everything when they come into you for short-term rehab. There's no reason then for you to know their history, is there?
Well, it helps. I mean, we'll know their past medical history, but in terms of when they got different vaccines, no, we don't know. And a lot of times they'll say, "I'll get it when I leave." I'll go see my doctor when I am discharged. So you hope they do. But you and I both know when you're in a healthcare setting, there are people that have, these different viruses that you can catch. If I had pneumonia brewing, I'm not going to really know I have pneumonia till I feel like crap. And I go to see my doctor, and then he's going to say, "Oh, my God." And that happened to me once. "You have walking pneumonia." Really? So then you find out, but how many people have been around me? So
right.
you don't know until the symptoms really, same with the flu, you just feel crummy. And then you realize 3-4 days later, oh, yeah, you got the flu.
And, of course, you're a younger person. When you start getting into your 70s and 80s and 90s, you don't really maybe have the body, what's the word? You don't have the sufficient
immune
system. Thank you. Sufficient immune system to fight it off.
Right.
And it can really take you down to a point. And a lot of people are thinner, and they haven't been exercising, and they don't really have much substance to help.
Well, I'll tell you, when flu season hits, that's the main thing that we're looking for when we go to evaluate a patient, is if they have the flu. Now, they may not have come in with the flu. It doesn't mean that they weren't diagnosed during their stay. So, and the biggest thing is, if the hospitals put them on Tamiflu, we know they had the flu.
I see. Now, so is there really something to help the flu? I thought when you have the flu, there's not much to do, but Tamiflu, is that what it does?
Yeah, theoretically, and I guess it works because everybody takes it if they have the flu. It reduces the symptoms a little bit and reduces the length of the flu. But, for us, when we review a record, if somebody's diagnosed with the flu, they have to have 5 doses of Tamiflu before we can admit them.
No kidding.
Because we don't want to spread it to
exactly
our residents. So, yeah.
Now, am I confusing Tamiflu when people have had breast cancer and they take something. Is that the Tamiflu or is that something else?
That's something else.
Must be something else. It reminds me of it that
Yeah.
they take some sort of a medication.
You know
all
that
the time.
commercial on TV where the person looks really big and they're miserable and they go to the doctor and he prescribes Tamiflu.
Yeah,
Yeah.
that's right. So that's what it must be. But as you and I know, it's not going to, make you jump up and
No.
jolly. I mean, you're just going to maybe not have the sweats and not have all the things that really happen to you.
Right. And some people can't tolerate it. Some people get nauseous and they can't tolerate it.
Oh, really?
Yeah, so it's a pickle. But when flu season hits, it's amazing how many people in the hospital have the flu.
And of course, what Dr. Mencia always says is you ought to get that flu shot before all the snowbirds come down because they're bringing all sorts of things with them.
Yeah. That's why they're already offering it, in various places because and you can't take it, you can't get it if you don't feel good. So if you have a cold, you can't go get your flu shot. You have to wait until your immune system is back up and running before you get the flu shot.
And you know what some people say about why they don't want to take it? They said they don't want to get the flu because when you're getting the shot, it's introducing the flu virus to you. And I mean, we know that that's not going to happen because it's such a minimal amount. But Dr. Mencia I keep quoting him because that's how I've learned so much about the flu. He does say that even if you get the flu and if you've had a flu shot, it'll be much less.
Right. That's it. I mean, yeah, you could get it because it varies, it mutates. So if I got the flu shot October 1st, August, September, October, December, it could have mutated somewhat. So yeah, I could pick it up, but you're still not going to get the whammy of it that you would have gotten.
Well, this is a good subject on inoculations in general. You and I are old enough to know when the polio vaccine came in.
Right.
I mean, every year we worried. My mother worried, people worried, and I knew someone that I've had quite a few people I've known that had polio.
Mm-hmm.
And so that's what science has done for us. So why would we now go against what people have been working on for so long?
I don't know.
What do they say to you, your friends and people? They don't believe in it, or?
Obviously, most of them got inoculated as children for mumps, measles, all those different things. Nowadays, there are parents that refuse to.
I know that.
Because
I don't understand this.
I know.
They attribute it to certain diseases, and yet you and I don't have any of those diseases.
No.
And yet they think, there's more autism, there's more of this and that. But that's just I think those are myths.
I believe they are. I mean, and a lot of people say they are, medical professionals. And unfortunately, those children can catch these things. And then they're in the school, and the symptoms don't show right away, and boom.
It's the same thing with smallpox.
Right.
For years, that was such a worry, and now it's unheard of. But there have been some places where they haven't had them. I don't know if it's the United States, but somewhere, and now they start to get a little bit of an epidemic.
Right.
So, yeah, well, I'm very much for this. I think it's the right thing to do. And as a matter of fact, I asked Bill if he had had his flu shot yet. And he said, I don't think so. And I said, Bill, you haven't had it. I know you haven't. And so I said, will you please call your doctor and get the flu shot? And he's very obedient because he knows that I will kill him if he doesn't.
Right.
And he called the doctor, and he's going tomorrow for the flu shot. He said, when he was in Walgreens, this is good. When he was in Walgreens getting his prescription this morning, as a matter of fact, they said, well, have you had the flu shot? And he said, no, but I'm not having it with you because he knows that I want him to do that. So he's now going to go to his doctor.
Right.
And, let's say the doctor notices something with Bill that maybe I haven't, and then he says, well, I don't know if we should give this to you right now. Right?
Right.
Where the Walgreens person has no idea who he is or anything about him.
You're right. And most people don't think about, if they're a little under the weather, they have to wait. It's just, or they're going to feel worse. So,
well, we've covered, of course, the flu, and pneumonia is really important because it seems that when an older adult gets pneumonia, it goes right to their chest. Of course, that's where it is.
Right.
And then it could really be a lot more serious. right? They
Yeah.
can't breathe. They have to go into oxygen.
Right. Respiratory treatments. I mean, people really get very ill with pneumonia, especially the elderly. They really get sick.
Now, your long-term residents,
Mm-hmm.
when they get pneumonia, do they have to go to the hospital, or you have a lot of that therapy there? Do you take care of it there?
We do take care of it unless they really get, bad, which they can. But, yeah, we can take care of that at Regents Park. We've got 24-hour respiratory. We can give the IV antibiotics if that's what they need. We can do the chest x-rays to follow up. So they don't need to go to the hospital. But again, you get pneumonia and you have other chronic things going on. That creates problems. If you have renal insufficiency and you're on IV antibiotics, it can exacerbate that. If you have a history of COPD and you get pneumonia, that's going to be exacerbated. So it's not just getting pneumonia. That's bad enough. But all these other, long-standing medical conditions that people have, and some of them have a lot, I mean, you figure if you're 93 years old, you have medical conditions. And that's the problem. It can really exacerbate other things. They don't want to get out of bed. They don't feel good.
They don't want to eat anything.
Right.
How are you going to get liquids down them?
Exactly. So it's a problem for again, mostly, the elderly with pneumonia. It's, and it can cause death because of all these other things that can act up.
So when you said you had walking pneumonia, had you had a cold? What was it? And then...
No, I just started feeling, that's what killed me. I just started feeling really run down. And I went to the doctor and he took a chest x-ray. He says, "You have walking pneumonia." I said, "No way." He said, "Yes, you do."
So how could that have happened with no other?
I don't know. And he said it does. That's why it's called walking pneumonia. You don't even realize that you have it. I said, "I don't have a cough or anything." I said, "But you have it,
And so were you put on antibiotics?
Yeah. And I'll tell you, I felt run down for weeks. And that's what happens. I mean, that was quite a while ago, but I was run down. And you see, our short-term people coming in, and they've had pneumonia, and they're still being treated, and they're run down. They're really debilitated by it.
So that's so important then for people to get their pneumonia shots.
Absolutely.
And remember to ask, are there 2 shots now? You can't have them at the same time. You have to have one, and then you have to wait for the second one. And I've just written an article about this in the upcoming October issue, in Dr. Mencia's column, and of course you can read about the flu in Leslie's column for Regents Park. But it is serious enough for us to do something. In fact, I think I just read another article. It was a national article talking about what they feel, how many people they feel are going to get the flu this year. I don't know how they know that. But
yeah, I don't. I'm not sure how they figured that out, but it's a lot.
Yeah, it is a lot, and so we have to prevent it. Now, we've been talking about the elder population because that's what you and I do. But do children get the flu?
Absolutely. And they can get a flu shot, and they should, because, again, like we're in healthcare, but look at an elementary school or middle school. All those kids coughing, hacking, touching, running out. It's so easy to pick up a virus. I think there's a commercial that shows, the kid coming home with all this stuff that he's touched all day in school. Well, yeah. Plus, people, kids, they don't always cover their mouth when they cough. And so they absolutely should.
So now people going on planes, that's really more important, isn't it, when you think about it? And, of course, I've never worn a mask, but I do notice some people are doing that, especially if they are prone, as you say, they have COPD or something that makes their respiratory system not so good. Okay, well, I'm glad we talked about that, but also now let's talk about the other shot that we want to talk about when you get this rough and raw problem, and it's from, I believe, from something to do with chickenpox, and I'm
Yeah,
not
it's the same
sure.
virus.
It is. It just comes out. The zoster. It's called zoster something. I wrote that too, and I don't remember what the other word is. But have you ever had shingles?
No. But that's a shot that, I'm going to get. Because I, see enough patients that come in.
You do. Don't talk to me about what you see.
And it is so painful.
And where do they usually, does it go around their waist usually?
Waist, back, and, I've seen it where they have it on their face and in their eye, and I just can't even imagine the pain that they must suffer.
Right. It's like a raw, like an open wound.
Yeah.
And I don't think you can put anything on it. I once had it around my waist, just minimally, and I wrote about this too. I could hardly put a blouse on because you couldn't have anything touch it.
Right. Very painful. And I've seen severe cases, and some that are more minor, like you were talking, but it's horrible.
And it does take about a week, I think, after you have it for it to slow down a little bit.
Right.
Now, are there medications for shingles? See, I don't know that, and I didn't write about that.
I think there are different salves that they can put on it, and then things for pain.
Oh, I tell you, we have a company that we work with, and they do lasers. And they told me that they can relieve people of the pain, but they can't do it right away. You can't put anything on it. You have to wait till it subsides, and then they have to be very careful. They put, before they can use the laser, which has to get close to the body, they put a special little cloth on. But they said that they can then start to relieve the pain. But it's a big process.
Right. And it just, the only thing I think about when I think about shingles is how painful.
Yeah.
I know that these patients who are in the hospital, they're getting IV morphine, and, it's painful.
For that?
Yeah.
For shingles?
Yeah.
Oh, I didn't know. So some people wind up in the hospital with it.
Oh, yeah, because it's so severe.
Well, then you and I are going to get our shingle shots.
That's right.
I don't want that to happen. I'm glad we're talking about it. Yes, I have to get down to Dr. Mencias and get that done. He's told me to do it. And even if, let's say, I don't know how you get it. You catch it. It is contagious, isn't it? If someone has it, stay away from them.
Right.
It's not that they can blow on you and you get it, but if you touch any place that they've touched, right? Because it's a virus.
Right. So it's contagious. And, if the shingles is open and oozing, you don't want to be anywhere near them. Unless you don't. You just don't.
So, how do your nursing staff, how do they protect themselves from all that?
Well, it is contact isolation, so obviously, you're going to wear gloves and, protect yourself and any other patients. But they are on contact isolation.
But they're put in an isolated room,
by themselves, yeah.
So they can stay in their own room if they're in a private room, can't they?
If they're in a private room.
But then you have to put them in a certain room, if not, right? Where they're by themselves?
Yeah, they need to be isolated while it's draining. Because they're little
pimples that open, right?
Open.
Yeah, and that's what causes it. Well, this is an important topic because Regents Park does so much good. Let me give you a way to, if you are in trouble, you can't stay at home, or you just come back from back surgery or leg surgery or knee or hip, you really need to go to a beautiful, beautiful place. It will ease your mind. It'll ease your body. Regents Park of Boca Raton is that kind of a place. And you can call Leslie at 561-483-9282. And I'm going to repeat that. That's 561-483-9282. And you can also go to YouTube and go to Boomer Times Presents. You'll be able to see this lovely woman and be able to hear a lot of the interviews that we've done. We've covered a lot of subjects.
Yes, we have.
Had you ever thought about writing a book, Leslie?
No.
You know a lot. Oh, you don't have the time.
Yeah.
I know. Your sister can write the
book.
My
sister
right?
can write the book, yeah. I would be distracted.
Yeah, well, that's right. Well, we're going to let you do what you do best, and that's take care of people and take care of staff.
Right.
You're very good with the staff. It seems like everybody knows you in the community. If I'll say something, oh, yes, I know. I know Lcurtis. Oh, yeah. You mean everyone, but you've been doing this a long time.
Oh, absolutely.
And you're a nice person.
Well, thank you. Thank you. I try.
Yeah. And so when we see you next time, I'm going to ask if you had your shingle shot, and you can ask me because I'm going to definitely get it.
Yeah.
Okay.
And, that's the thing you always say. I'm going to get it.
I know.
And you keep putting it off.
I know it.
And I don't know why.
Because we're busy, and it makes, well, at least for me, I have to go down to Dr. Mencia's, and I actually have to do it. But I'll have another excuse. I'll do something else and go down that area because I don't, I have a very busy schedule as you do.
Right.
What am I going to do? Not come here naked, to the radio station and not touch anything?
Yeah.
Can't do that. In fact, how do people sleep? They have to lie down on a bed.
Yeah, I know. It's horrible. That's why I said, the pain with the shingles, if it's on your back and you're normally sleeping on your back, how are you going to get comfortable?
Right. Yeah, no, it's a big issue, and especially if you have children, they should definitely have it done. I'm going to talk to my daughter-in-law, but we'll see what she says because, when you have triplets, if one gets one,
oh yeah,
they're all going to get it. But everybody has their own feelings about it. So I'm going to I'm not going to push, but I'm going to promote.
Yeah.
I'm going to send her the column I just wrote. Said, okay, because I don't even know if they get flu shots. And they should. Maybe the school makes them do that. I don't know. Do schools
They don't
do
make
that now?
them.
They suggest?
Yeah, absolutely.
And do they have people that come to the school to do that?
Not anymore.
You have to go Well, Leslie, we've done it again, and you always have such great information. And watch for her great article coming about the flu in the October issue. And that, again, is you can go to their website, which is regentsparkboca.com. It's a place you want to visit, and if you need to go to a rehab center or you have family members that need long-term care, go and give her a shot and let her show you just what they do. You can tell how she is, and what she has is what Regents Park has. Thank you.
Thank you so much.